Jumping into behavioral health, which has been something certainly that we've all been impacted, or rather, our behavioral health has been impacted, all of us in this pandemic. We're going to learn about the Behavioral Health Task Force, its priorities, and the next steps from the director of the Colorado Office of Behavioral Health here with Robert Wertheim. Robert, why don't I have you jump in? You're going to have shortly Lieutenant Governor Primavera with you. So take her away.
Great, thank you. I'm lucky to be joined by Lieutenant Governor Primavera, who's the Lieutenant Governor for our great state of Colorado and also the Director for the Office of Saving People Money on Healthcare. But first, I want to do a quick overview of the Behavioral Health Task Force. The Governor called to action and asked Lieutenant Governor to lead an effort along with several of the cabinet members to have a task force on addressing behavioral health in Colorado, recognizing that there's a need for reform. And the Lieutenant Governor and the cabinet had really led the way, and what ended up being a really robust and thoughtful, thorough report. So the main theme for our task force really was putting people first. And we were excited, and we had lots of stakeholders throughout the state of Colorado. We had more than 100 members contribute officially, either through the task force or through its subcommittees, to sort of come up with the structure and the results and the outcomes. And I'm going to briefly touch on what those recommendations are now. Now, I am not able to move the slide if someone can move them for me. So in our work, it became overwhelming how much there had to be done and how much effort and how much focus need to be given to a wide variety of issues, and we need to find a way to sort of create buckets. And what we ended up doing as a task force is creating 6 pillars. These 6 pillars are access, which tended to be the main theme that we heard from Coloradans throughout the state. There need to be more access. There need to be equitable access across all consumers. And that really drove most of the conversation, but it wasn't all we talked about. There were other conversations around affordability. And affordability is not just consumers being able to afford care, but it's also about payers being able to cover the cost of care and paying at a rate in which providers could sustain their business and be able to sustain their practice as well. In order to do that as well is workforce and support. That's another pillar where we talked about not only the size of the workforce, but the makeup of the workforce. And we're going to talk a little bit later about that. Let's talk about accountability. We're going to talk about investing in a system and reforming the behavioral health system in Colorado. We really want to make sure that we're accountable to the outcomes. And the main outcome is that we're serving Coloradans in an efficient and effective way. And we want to do this with local and consumer guidance. We don't want to build a system and in 10 years look back and say, oh, this didn't help the people of Colorado, it didn't help local communities, and it didn't help consumers. So we need to listen to these individuals, not only listen, but we need to make them a sort of a purposeful and formal structure of the system itself, and have them included in a very formal way. And then whole person care. Behavioral health, we talk often about behavioral health as sort of as if it's isolated, but we know it's not. We know that whole person care is really important. We know that there are a number of social determinants or social influences of health that need to be considered. And we know that housing is one of those. We know that physical needs are another area of those. And there's several areas that I'm not going to get into at this moment, but we need to look at the whole person when we approach behavioral health if we're going to be effective in that behavioral health. So with all these recommendations, we had over 200 and something recommendations. We whittled them down to 150, and that still felt really overwhelming. So the task force was tasked with creating 3 phases so that we want to make sure that this is not a blueprint or a report that just sits on a shelf and collects dust. It has to be actionable. We want to have outcomes. We want to improve the system for Colorado. So we had 3 different phases. Phase 1 is create a behavioral health administration. And we're currently in this stage right now. We just hired a vendor who's going to help us sort of create a proposal on what a behavioral health administration would look like. In Colorado, we have 75 different behavioral health programs across 10 plus different state agencies. and they're not all very well coordinated. And I'll admit my office is one of those. We're not very well coordinated with each other, and we're often doing parallel effort where we could be more efficient and we could be more effective if we coordinated together. So the proposal is to create a behavioral health administration that would coordinate and align all these programs across the state of Colorado. Now that's going to look different. We don't know what that looks like for each behavioral health program in Colorado, and that's what the next 6 months will be. This vendor will meet with all the different state agencies and make a proposal and a recommendation about which program should be incorporated into the behavioral health administration and which program should be aligned with and how they interact in a successful manner for each program. So that's the work we'll be doing over the next 6 months. The other effort we're currently undertaking is expanding and increasing telebehavioral health services. The governor and the lieutenant governor have put forth a proposal for the General Assembly to consider on improving broadband technology and broadband access across the whole state of Colorado. We're really excited by that. And as part of this effort, the Office of Behavioral Health and Healthcare Policy and Financing have been able to put forth their own proposal on how to improve telebehavioral health and telehealth components. So one of those proposals is to have us all operate on a single financial system through the Encounter database. That way we have a better idea of what we're spending on behavioral health, where our gaps are and where our needs. The other area of telebehavioral health as well as we're looking for in our proposal is better data sharing through the Health Information Exchange, as well as the potential of creating a virtual platform, particularly in these times of COVID, where we're seeing that individuals don't want to have face-to-face interaction, but they still need that care. We're looking to have a virtual platform, particularly for crisis services. And then the third is we're going to be efficient and effective. We need to clean up our statutes. So we need to review our laws in Colorado and make sure that they all make sense and they're all written in a way that they coordinate with each other. We, through the years, with no fault to anyone, sometimes take a Band-Aid approach and we keep adding things. Now it's time to take a step back and see how all those components of behavioral health and statute interact with each other, as well as identify potential funding sources, both here in the state and at the federal level. Phase 2, implement care coordination. So this was a very interesting conversation in the task force because we heard a lot from consumers and a number of really sad stories, but one horrific story of a mother who lost her child because she didn't have the care coordination she needed. With each new provider she interacted with, she was starting over, and there were too many gaps in between the care. We think it's really important that we take a better customer service to behavioral health in Colorado and really have that engaging approach and offering coordination of care across all types of care in behavioral health across all providers, not care coordination that just stops when that provider is done interacting with that person, but someone who can actually walk through the system with consumers and families, because it's a complex system. Particularly for those that are not in this system, it's very complex and it's very frustrating. So if you're in a crisis and you're struggling, and then you have to try to navigate a complex system, it becomes even more frustrating for those individuals. And then the task force prioritized the 19 recommendations they'd like to see tackled first. Each one of those pillars had 3 or 4 recommendations that sort of floated to the top that are going to be tackled through the second phase. Some of that work is going to happen in phase 1. We're not going to wait. We're going to do what we can now, but they'll be completed through phase 2. If you're really interested, there'll be a link provided. We'll be able to put this in the FAQ document that's being put together for the full report, so you get to see all those recommendations. And then phase 3, the work doesn't end. That's what phase 3 is. Phase 3 is 2 components. The Behavioral Health Administration will continue to improve upon the system. That work will never end. It's an evolving system. So if we're going to be effective and we're going to do it right, we can never say this is good enough. That can't come out of our mouths. We always need to say we can do better. So that is phase 3, along with the other 140 something recommendations to go with those 19 top recommendations that we need to keep working on. So with that, we're going to move on to some calming questions and some questions that we received. So I'd like to be joined by the Lieutenant Governor Primavera here. One of the common questions we have, Lieutenant Governor, is whole person care also talking about integrated care?
Thanks, Robert. Yes, it is, as a matter of fact. You know, when the governor and I first sat down, when we started working together in this administration, we talked about how all roads lead to health. And whole person care means that we put people first in our systems so that they can get the support that they need to be well in all aspects of their lives. And as you mentioned, you know, if you don't have a place to live and you don't have a refrigerator, you can't store your medication. When you can't put food on the table, you're not going to be healthy. When your car is broken down and you don't have a way to get to the doctor, you can't be well. So Coloradoans are best served and have the best chances for improved health when their physical and behavioral health care is integrated, and you don't cut the head off the person, because they both are important. And also when you other social influences, as I mentioned, of health are addressed. And also important is that they receive care in a culturally responsive manner. As you said, the task force put forth recommendations to address the need for these types of supports that often fall outside of the clinical behavioral health services that they also need. And of course, you know, the lack of coordination between systems, as you mentioned, has created lots of problems for people. So this can be a system that centers whole person care, puts people first, and makes sure that Coloradoans are supported in all aspects of their lives in order to be healthy and actually to thrive. So, you know, I have a question now for you, Robert. So one of the things that came up over and over was, how will healthcare policy and financing and Medicaid be integrated into or aligned with the Behavioral Health Administration?
Yeah, it's a great question. It did come up a lot during the task force, and it's a question that continues to come up. The good news is there is a real commitment from Healthcare Policy and Finance, as well as the other state agencies and Division of Insurance, to have a conversation about how Medicaid and commercial insurance is integrated or aligned with Behavioral Health Administration. 3.5 million Coloradans have private insurance or Medicaid or are Medicaid members. So it's really important that we have a robust conversation about this. As the task force discussed the Behavioral Health Administration, there really wasn't enough time to get to the complex system of Medicaid and private insurance and tackle within our year. So there was a commitment to continue this work, and that work's going to continue this year as we move forward to talk about what the role of Medicaid and private insurance and how it will align or integrate with the Behavioral Health Administration. Contractor has been engaged to help complete this work over the next 6 months, so we're excited by that work. And there's a commitment from the Department of Healthcare Policy and Finance and the Division of Insurance to align efforts to ensure behavioral health services are provided to all Coloradans. I'll have to say, through the task force work, just by having a task force and bringing the cabinet members together, it was really beneficial. That in itself really led a direction towards how we're going to work together, because we don't know what we don't know. And I think a lot of us learned about other agencies that we didn't know. And people are really energized right now, particularly the cabinet and yourself, Lieutenant Governor, seem really energized about getting this right. This will help to further promote health equity in our state. And it's been clear, and I have to say that Director Binsteffer has been great and really passionate about this topic. And I'm always surprised when people are like, well, Medicaid should be involved, as if they don't want to be. She's been really passionate about wanting to get this right and making it work without compromising the really good work, particularly the work that's been done on the integration of physical health and behavioral health and primary care. So Medicaid and private insurance are a significant part of where Coloradans get their healthcare coverage. Which includes behavioral health. Therefore, the BHA will consider Medicaid and other payers in their work as well. So it's not just one directional. It's not just healthcare policy finance thinking about how Medicaid is integrated into the Behavioral Health Administration. Behavioral Health Administration also has to think about how private insurance and Medicaid integrate into the work and their strategic planning as well. So that's the Medicaid part. Another really common question, or a question we received often, is that if you would like to answer is, was there an intentional review of the blueprint recommendations through a diversity, equity, inclusion, and justice lens? How'd that occur?
Yeah, you know, health outcomes shouldn't be determined by the color of your skin. And we know that the healthcare system in Colorado and across the country actually has much more to do to bring racial justice to the forefront of our health policy decisions. We also know that we have to earn back the trust of Black, Indigenous, and other communities of color that for centuries have been mistreated by our healthcare system. We also know that many other groups experience behavioral health disparities. And we heard that over and over in our listening sessions that we had, and such as people with traumatic brain injuries and veterans and farmers and LGBTQ plus communities, people with various disabilities, intellectual and developmental disabilities, the deaf and hard of hearing and the deaf blind Coloradoans. We had a real gut wrenching focus group with them, and older adults. And the task force committed to reducing disparities in behavioral health conditions across all populations. So the Polis Primavera administration is committed to building a Colorado for all. You've heard that. And one of the values embraced by the Behavioral Health Task Force and included in the blueprint is about behavioral health equity. So Colorado will do better to identify, to monitor and respond to behavioral health disparities across our populations. This includes expanding workforce capacity to improve outreach, engagement, quality of care for marginalized populations, and culturally responsive care. A systemic approach to collecting, reporting, and analyzing data, as I mentioned earlier in my opening remarks, and collecting demographic information will help identify inequities that need to be addressed in our system. And health equity will be foundational to all of the work going forward as the task force recommendations are implemented. So I've touched a little bit about workforce, and that was another issue that came up. We just really don't have enough people to provide the kinds of services that need to be provided. So Robert, how is the workforce shortage being addressed? Can you talk about that?
Yeah, well, access was the biggest challenge that we were presented with. Workforce was up there as well. We need a high quality, trained, resource, culturally responsive and diverse behavioral health professional workforce that delivers improved health and access to Coloradans. Currently, the public doesn't have access to enough behavioral health professionals in Colorado, which means sometimes people wait weeks or months for their care. We need more professionals, everything from peers, peer support specialists to psychiatrists, and everything in between. We're forming a workforce group coming up this year that will begin to identify solutions, both short-term and long-term, to shore up the workforce. As you know, all these things are dependent on resources, Lieutenant Governor. So what is the impact of the pandemic and budget crisis on this?
As you know, because the governor created the Behavioral Health Task Force, our administration has made behavioral health reform a priority. We knew that it was broken, so we're committed to continuing this work, but we know this will take a concerted effort, especially given the impact of COVID-19 on the budget. But despite our resource limitations, though, we're thinking creatively about what we can do to work together to solve these issues. The COVID-19 pandemic has impacted all of our mental health. Some of us, it's been impacted more than others, but regardless, it's highlighted how urgent it is, and we won't let up on our charge to improve it. Robert, we're trying to reform the system. We plan to reform the system. We're working to reform the system. We've gotten a lot of ideas about how to reform the system, but how will we know if this behavioral health system is working?
Yeah, and I'm going to keep this short because I know we're almost out of time. But I'll say this: data is important. But I want to commit to our providers out there that we know we collect a lot of data. And part of the Behavioral Health Administration task, and the Office of Behavioral Health has already started this, is to not necessarily ask for more data, but to ask for the right data. We're already in the process of looking where we're being duplicative between different agencies, and let's streamline that data. Let's use the health information exchange and be more thoughtful about how we ask for data and how much data we're asking for. But we need that data to know that we're making a difference. So we need to continue to our efforts and set standards of care. We have to make sure that we're being good stewards, not only taxpayer dollars, but setting the right standards of care for Coloradans so they're getting quality care. At the end of the day, it's about a behavioral health system that puts people first and helps Coloradans. And I want to thank the Lieutenant Governor and all the cabinet members on the task force for putting in a year's worth of intensive work, because we're now committed to making real change and helping Coloradans. Anything you want to add, Lieutenant Governor, before we wrap up?
I just want to thank all the people who have helped us along the way, the people that participated in the listening sessions, the people on the different task forces and subcommittees, because we couldn't do this without hearing from people about what's broken and what needs to be fixed. So thank you, Robert, for including me in the conversation today.